Plantar fasciitis is inflammation of plantar fascia. Plantar fascia is a thick band of tissue at the bottom of the foot that connects the front of the foot to the heel bone and making it stable. Plantar fasciitis happens because of inflammation and macro tear of the plantar fascia, especially at the site it connects to the heel bone. Those micro tears happens typically because of repetitive strain or stress on the plantar fascia, and the body tries to heal it. It creates the scar tissues. Every time we step on it, we break those scar tissues and we feel it as pins and needles kind of pain. The good news is a lot of plantar fasciitis can improve on their own. About 50% of patients feel better at 3 months. By the end of 1 year, 12 months later, about 80% of patients improve on their own. The bad news is 20% of patients do not improve even if they wait 12 months, and the other 80% may need to tolerate the pain for up to a year to feel better. Having said that, there is now a good treatment options for plantar fasciitis. It's called PFE, or Plantar Fascia Embolization. PFE is a procedure in which we go and find the blood vessels that supply the area of inflammation. We send these tiny particles to decrease blood flow to these areas and bring them back to a normal level and break the cycle of inflammation. This helps patient alleviate the pain and gain function much faster, sometimes immediately after the procedure. The procedure itself is minimally invasive. There is no surgery, there is no cutting. It's done via a small catheter, a small needle. So we put a small catheter in an artery, and on the x-ray we send that catheter to the area of inflammation, do the procedure, and come out. The effect of plantar fascia embolization is fairly immediate. The recovery is quick, there is no downtime. Patients can walk and do normal activities immediately after the procedure. About 80% of patients feel better. Some not all the way to 100%, meaning that they feel better, they gain function, but not to their baseline and original level of activities. Those patients may require a repeat procedure. On average, people require 2 procedures to gain full function.